Hello and welcome to the Albany Med Update. I'm Jason Mazakis. Today is July 22nd, and joining me today is our Chief Nursing Officer, Kevin Zhang. Kevin, welcome.
Thank you, Dr. Mazakis. Happy to be here.
Great to have you. So today I want to cover a few topics. Our rundown will include some Albany Med highlights, employee recognitions, which is always a lot of fun, and we'll get into your role as Chief Nursing Officer, and we'll talk a little bit about nursing.
Sure.
Sound good?
Wonderful.
All right. So when I think about Albany Med, I think of a few words and phrases: team effort, collaboration, and the spirit of being first in the region for so many items. We had a special event in the surgery area recently, and this included our skull base surgery team. This is a unique team that's comprised of ear, nose, and throat surgeons, neurosurgeons, eye surgeons, and they all collaborate on very complex head and neck tumors, brain tumors, skull tumors. And recently we had a young gentleman who presented with a very benign tumor. However, it was located on the hearing nerve, resulting in profound hearing loss and an expansile or growing mass in his skull. So the team met, collaborated, Dr. Nathan Tu from the Department of ENT and Dr. Rob Heller from the Department of Neurosurgery, two really accomplished and expert surgeons, and they collaborated to safely remove this tumor from this young man. What was unique was that during that same removal or excision of the tumor, Dr. Tu was able to collaborate and place a cochlear implant, thus restoring his hearing at the same time. So really incredible work, a first for the region. Kudos to the team. And again, I think it really embodies the spirit of collaboration that we have here at Albany Med.
That's wonderful to hear. That's your bread and butter as well, right?
Absolutely. Ear, nose, and throat, very close to the heart.
Yeah.
I want to move into some recognitions, and I really, truly enjoy my role to be able to bestow these recognitions on our employees. And we had a few Daisy Awards recently. The first, Patty Jardine, who's one of our Daisy Award recipients. She's a stat nurse in the pediatric area. Tell us about stat nurses and their role in pediatrics.
Yeah, so and I think we have the similar team in the adult side as well, but our stat nurses really too, they're the experts. Most of them are, well actually all of them are prior critical care nurses, and really serve that expert role in resuscitating and sometimes rapid response in terms of patient that needs in the hospital, and being that team leader to be able to help those patients and families and other team members. So yeah, it's a rewarding work and definitely challenging as well.
Absolutely. And I think Patty really embodies the spirit of the Daisy Award. Her nominator wrote, "Patty is a calming presence and put us at ease during a situation that was scary for us as parents. My wife is a nurse too, but Patty still made sure to explain everything to us and answer all of our questions. She was skilled and gentle." And so congratulations to Patty.
Yes.
This past week, we also had Haley McKay from Labor and Delivery, and she was nominated from one of her patients who underwent an emergent C-section. And the family wrote, "Haley was an overnight nurse, and she made sure no matter what I needed, I got it as soon as possible. She was amazing."
Yeah.
And we'll continue on the theme of recognitions and highlights. So Albany Medical College was awarded $2.4 million to study chronic hepatitis B, and they received this grant from the Department of Defense. Now, hepatitis B affects literally millions of people. 300 million people worldwide are affected. And we know that hepatitis B causes chronic liver problems such as cirrhosis. It's a setup for liver cancer. And this particular study will look at the role of immunity, and specifically a special cell type called the dendritic cell, and its ability to fight hepatitis B, in the hopes of hopefully discovering new technologies and therapies. And what's interesting about hepatitis B, and we're both healthcare workers and hopefully vaccinated against hepatitis B. Vaccines prevent infection. It's important to note that, but they really can't help those who have the disease already. So I think this is such important work. led by Dr. Michael Robeck, who's our Department Chair of Immunology and Microbial Disease.
Right, that's right.
Kevin, let's talk about you for a second.
Sure.
Chief Nursing Officer. So before we get into your role and some of your reports, tell me a little bit about what inspired you to follow your path in nursing.
Yeah, I would turn that to say what made me stay in nursing. I think, you know, a lot of us, I know that we have in our workforce, we have nurses who've been here for 52 plus years in Albany Med. That's testament to the dedication to this profession and also to Albany Med organization. I think what really made me stay in nursing, though it's challenging and then work, but also rewarding. I think, you know, whether it's from a leadership perspective, from a quality improvement perspective, or quality colleagues, or from a clinical perspective, we have our, you know, 1,000+ strong nurses here working every day. Really is the part that we're making the patients better. We're making people better. You know, a good policy could help hundreds of employees and thousands of patients, similar to clinicians, how they treat and you as one as well, and to help them. So I think that's the motivation that drives me to. And again, work obviously could be challenging, and there's a lot of things that it's complex in healthcare. But you know, solving it one by one, whether it takes some time at times, or things that we could mitigate immediately. I think those are the things that keep me in the profession.
Absolutely, and I think our nurses, without doubt, are a true backbone of our organization.
Yes.
When I consider our tripartite mission of clinical excellence, research, education, they really embody all and embrace all of those values and important mission pieces. Tell me a little bit about the folks in your immediate managerial level, the AVPs. They're very important to you. They directly report to you. Tell me about them, maybe call them
Sure.
out, give them a shout out.
Yeah, absolutely. So we obviously under me directly, we have a team of our assistant vice president and directors and associate chief nursing officer, Mary Alice Cullen. I talked about her last time. We have Casey Savage, our AVP of Women and Children. It's overseeing that service line. We have our AVP of Critical Care, which was Jenna Wood. You know, does a great job as well in the critical arena, sick patients, obviously. We have our AVP for Medicine Medical Services, Jennifer Miller. Has been here for a long time, as well, a wealth of knowledge on that. Of course, we have Sharon Besto, our AVP of Peri-Operative Services. That's obviously helping us along, and we have a lot of folks that you know, want to miss people's names, but under my team, and I think, and I would just.
We have a new face.
Yeah, and and
medical surgical.
Our
right?
interim post-surgical AVP, Shannon Kelly, which has been our trauma floor B3 unit manager for a while, and so thank you for her for stepping up and really helping out in that service line. I think for that theme is that, you know, all this to nursing and patient care services, as you mentioned, Dr. Moustakas, it's a team work environment. None of us do anything by ourselves, and really just to get that all moving with our staff, with our management team, our leadership team, all the managers and assistant managers, our educators, really keep the whole Albany Med, and to your point, backbone, but going.
Absolutely. And I know that you truly embrace your role and the importance of retention and recruitment in our workforce, and that absolutely is so vital, especially for your book of business with nursing. Tell us a little bit about some of the pipeline strategies that you've come up with in your year.
Yeah, and I think it's no secret that healthcare under quite a bit of evolvement and or change in post-pandemic, and I think, you know, from a workforce perspective, you call it out, retention, recruitment for our workforce has been the main focus. There's lots of unique differences and challenges in those realms. And I think you mentioned pipeline. Definitely been collaborating with a lot of community academic partners. I'm really trying to come up not just the next 5 months or next year. What about next 5, 10, 25 years? How do we look? I'll just give some data here. All the Capital District nursing graduates, every single year, if you count all the graduates, nurses, I'm talking about registered nurses, and look at some of the vacancy we have in all, I would say, healthcare facilities in the area. If we don't retain, and our understanding, I will speak a little bit more about the generation as in terms of the workforce, aging part of it too. That's not just nursing. That we might not even fill all the vacancies, right? So there are things that, as senior leaders, to really have to think ahead. A 10-year, 20-year plan to how to make sure we partner, listen, and I think that's something that we listen to our staff as around and different forums to really build those strategic partnerships and guidelines. And I think we have proud partnerships with Russell Sage College for many years. Now that we have other partnerships with other universities and then colleges that hopefully it will be coming along as well. But I know we have our other marquee partners, Maria College, Hudson Valley, and et cetera, et cetera. So I think more to come, but we're definitely thinking ahead of time and see what we can do. And I think the good news is, I would say, from market perspective, from higher education in this area, there's lots of interest and applicants into nursing schools, for example, or other health allied schools and programs. We just need to make sure how can we partner to increase that capacity to help people to get into the career that they want.
Absolutely. And I think it's a natural fit for our campus.
Sure. Yes.
With engagement of learners, this is an educational hub.
Right.
So it makes sense for us to pursue these creative options, and we look forward to your ongoing wisdom and oversight to this. Last question. What's significant about July 24th in 2 days?
Well, it's coming up in a year. So I think I've been here almost a year. Time flies. And I will just take that opportunity to thank our workforce. I think I visited all 50 departments, obviously, during my time here, some multiple times, and different occasions, and some invited to their staff meetings, and thank you for those departments as well. And I think, the very important thing is, it's not my kind of the personal piece of it for the year mark, how so much more that what I have heard from our staff. I think, we talked about a lot of things just now. Understandably, there are things that we do really well, and we want to make sure we want to lead not only the region, but nationally on some of those things that you just talked about, and the nursing practice as well, and share that nationally. But in addition, we know also we have challenges, and I think not be able to open to hear those things and ideas. We had good ideas. Sometimes we're talking to our staff, our frontline staff, coming out from just from whether it's casual conversation or formal meetings. I think, and a lot of folks that have taken up to meet with me, even if it's on again private setting or group setting. Really, just I'm honored and be proud to be here for this past 12 months, and really working with a great group of clinicians and backbone of our organization and community. So again, hopefully many more years to come, but and I'm here definitely to make sure to serve, to get our retain, and you talked about, and recruit our workforce, and really impart into the mission to serve the capital region. That's
outstanding, and wishing you lots of success in the many collaborative years ahead.
I appreciate it.
So we'll finish with a system-wide accolade. So Albany Med Health System, really proud of the recognition from U.S. News and World Report in the area of high-performing health systems. And each of our campus received recognition. So I'll start with Albany. We'll go in alphabetical order. Albany Med received high-performance recognition in the areas of leukemia, lymphoma, myeloma, colon, lung, and prostate cancer surgery, repair of abdominal aortic aneurysms, heart bypass surgery, heart failure, kidney failure, hip replacement, knee replacement, and COPD. So quite an array of disease states that we treat really, really well. So very proud of that accomplishment. Continuing on at the other campuses, Columbia Memorial Hospital was recognized for its treatment of hip fracture, Glens Falls Hospital, heart failure, maternity care, which is, of course, the Snuggery, which receives lots of accolades, and COPD. And then finally, rounding out Saratoga Hospital, heart attack, heart failure, hip and knee replacement, COPD, and pneumonia. So what a great way to finish the segment on a system recognition.
Yeah, and then I think, again, thank you for the teamwork that provided
Absolutely.
all those services to our community.
Takes the entire system, the entire community. Well, thank you for joining us today. We hope everyone has a great week. And as Dr. McKenna always reminds us, take care of yourself and take care of each other. Thank you.
Thank you.